truly appreciate. And as the Rotary Club of Nairobi Thika Road, we honor. Okay, thank you. Okay, thank you. All right. We honor every theme of every month, and next month will be Disease Prevention Month. And last month, which is October, we were celebrating, or rather, amplifying the theme on breast cancer awareness. And the theme for this year's breast cancer was that early detection saves lives. And there is a clarion call for every person, every female, every male to go for early screening. And these cancers that we have been discussing are at the leading cause of cancers amongst the top cancers that we have in the world. So it's very important for all of us to take note and take charge of our health and take charge of our bodies. And that is why we have organized this webinar for you all, so that we amplify the message that early screening saves lives. I am not the expert here. I am not the doctor. We have a panel of doctors who will be leading us on this panel. And without further ado, allow me to welcome Dr. Diana Wangeshi, whose background is in medical. She's a nurse, actually, but she's going to tell us more about herself. I really don't want to butcher her great CV. So without further ado, allow me to hand this over to Dr. Diana Wangeshi, who is a Rotarian of our great club, and she's been taking lead with all these matters around disease prevention. Dr. Diana, over to you.
All right, good evening, everyone. Rotarians, a family of Rotary and guests. My name is Dr. Diana Wangeshi. I am a member of this club and I'm excited to be here. My classification is health. I'm passionate about community. I'm passionate about women's health, and my research is in cervical cancer. And that is why today we have brought a very able expert panel to be able to shed lights onto us. So just to bring you up to speed, it is in Kenya whereby we have 5,000 new cases of cervical cancer being diagnosed every year. It is here in Kenya that we have 3,000 women dying every year of cervical cancer. So cervical cancer is the second highest in terms of incidence in Kenya, but it is the leading cause of death among women. And what we say is that cervical cancer is preventable. So I don't want to say much, but what you need to remember is that we are losing 9 women every day from cervical cancer. So I'm going to introduce our team of panelists so that they can be able to talk more about cervical cancer and be able to shed some light on what we don't know. So our first panelist is Dr. Joan Siman. Dr. Joan Siman is the head of research and data informatics directorate at the National Cancer Institute of Kenya, and she's going to tell us more about her research work and what she does at NCI Kenya. Then we have Jeniffer Muema. Jeniffer Muema is an MBA in finance holder from University of Nairobi. She is a cervical cancer survivor, and she is a founder of Jeniffer Cancer Foundation. And the main reason for this foundation is to be able to give hope to cancer patients and also provide information and organizing and doing cancer screening throughout the year. Then also raising funds to support cancer patients and survivors. Besides this, she is a science teacher and she's going to tell us more. And we also have Julie with us. Julie is Julie Matiba. She is an oncology nurse. She holds an MSN, a Master of Science in Nursing in Oncology, and a Bachelor of Science Nursing from Aga Khan University. She works as a Principal Nursing Officer in charge of the Specialized Reproductive Health Unit at Kenyatta National Hospital, if you know it, Clinic 66. She has a wealth of experience in the oncology space, having worked in Pediatric Oncology Unit for 10 years and now works in the Gyne Oncology Unit. So gynecology and oncology, which is the cancer itself. She has worked there and since 2009, and she's an advocate for women reproductive health and especially cervical cancer screening and treatment of cervical dysplasia. So she gets involved in educating and teaching both patients and colleagues, a committed member of the Oncology Nurses Society Kenya, and she is also a cancer survivor. So she has received several awards for her role in cancer space, which includes a trophy for the Nightingale Award as an overall best nurse in the year 2021, 2022 and a plague for a celebration of women who empower women in Nandi County in March 2023. So, ladies and gentlemen, help me welcome our panelists, and I will allow them to introduce themselves. Then we're going to get into the questions that they're going to tackle. So, welcome, ladies. We will start with Jeniffer. Please say hi to us.
Hi.
Hi,
Hello,
Jeniffer.
hello.
Hello, we can hear you.
Hi, everyone. My name is
Hi.
Jeniffer.
Hello.
Jennifer is a cancer survivor, and I was invited here to give my story. And yeah, just to give information about cancer, especially cervical cancer, because I've gone through it, and I believe through this meeting we'll be able to know more. I'm a teacher by profession. As you've heard Dr. saying, I stay in Mombasa. I'm a 50-year-old woman. I just turned 50 this year. Cancer came when I was 38. So I'm shouting my age because of what people think when somebody gets cancer. Yeah, in short, that's it. Thank you.
All right. Thank you so much, Jennifer. I'd like to invite Julie. Please unmute and say hi to us.
Good evening.
Good evening.
This is Julie. I'm so honored to be among you to share information and to learn from one another. It's a blessing just to be able to join the Rotarians of Thika Road. Thank you.
Thank you so much, Julie. And we have Joan. Joan, please say hi to us.
Thank you, Dr. Diana. Good evening, Rotarians. So I'm happy to join the conversation today on HPV and cervical cancer in Kenya. So I work for the National Cancer Institute of Kenya, which is a government agency under the Ministry of Health. So our main mandate is cancer prevention and control. The agency was formed as a result of the increasing burden of cancer. So during the, I think, conversations that we'll have, we'll talk about some of the things we do and some of the gaps and challenges and where I think we hope to be as a country in terms of cervical cancer elimination in the coming years. Thank you. Happy to be here.
Thank you so much, Joan. And apologies that my camera is not on. I'm having issues with the camera, but if it's going to come on as we proceed, it's good. So I'll start with Julie, and I'll ask you a few questions so that you can be able to just guide this conversation. So maybe Julie, you can tell us, you can explain to us what cervical cancer is and how cervical cancer develops.
Thank you, Diana. Cervical cancer, like any other cancer, is cancer, first of all, is uncontrolled cell division or cell destruction. So that means the cells in the body cannot operate as normal, and that they divide unusually. So what is cervical cancer? Cervical cancer occurs when healthy cells of the cervix, of the uterine cervix, develop into abnormal cells that can multiply and spread to other parts of the body. And that is mainly caused by persistent human papillomavirus infection. Thank you, Diana.
All right. So what role does the HPV infection play in cervical cancer?
Human papillomavirus is a sexually transmitted infection. And there are there are several species of human papilloma virus, but there are some two very common HPV viruses, which are called number 16 and number 18. They're called 16, 18. Those are the high risk ones. So once you get HPV and you get the high risk HPV, it can change the cells in the cervix to abnormal cells, and which can lead to precancerous lesions and then cancer eventually. However, HPV can be cleared by the body normally. But the high-risk HPV infections have a tendency to persist and cause changes in the cells of the cervix. Thank you.
All right, thank you so much. Joan, I'd like to ask you, so what does the current data show about the burden of cervical cancer locally and globally?
Thank you. So I think you already alluded on the statistics, the 5,000 cases that Kenya records every year with 3,500 deaths, which is about, for every 100 women that are diagnosed in a year, we lose around 62 women. So as much as we talk about numbers, so we all know that women are the backbone of most of the families. So the 5,000 families are affected by the diagnosis, and that leads to a number of other related effects. So Kenya has similar patterns with most of the sub-Saharan countries. So you'll find cervical cancer is most common within low middle income countries. So you'll find around 90% of deaths occur in low middle income countries as opposed to the developed countries. And I think for most of the developed countries so far have acted on how to reduce the burden. So emphasizing on prevention. So we already have proven methods of preventing cervical cancer through vaccination, HPV vaccination. We also have early screening for early detection, and also timely treatment, which will prevent the unnecessary deaths that we are seeing in most of the sub-Saharan countries. So so the numbers that we see, so the 5,000 cases that we see being recorded, the data normally comes from the WHO, International Agency for Research in Cancer. So as an institute, we are mandated to collect cancer data on cancer cases within the country. So we work with different health facilities that offer cancer care. So whenever there's a cancer case that is reported, that is diagnosed, they have to report it to the National Cancer Institute. So over the past year, we've increased efforts to actually get the data in, so get the numbers to inform policy and also budgeting on the cancer control programs that for the country. So these numbers may be underestimated. So the 5,800 cases that are reported may be underestimated because they mostly come from what we call registries, which we currently have two population-based registries in Kenya, one in Nairobi and Eldoret, so which may not be representative of the diversity we see in Kenya. So we are also increasing that to around 7 population-based registries now, so that we have accurate numbers, be capturing accurate numbers that will help in planning, and also when designing programs, screening programs, and where to target some of the prevention or screening, we actually have a better picture of what's happening in the country. Diane,
All right.
yes, I've answered.
Thank you so much, Joan. I appreciate. Apologies, I was kicked out. I want to come back to Julie. And as you're trying to explain to us about the interaction between the HPV infection and how it causes cervical cancer, I would like you to probably explain to us further. Are there key methods that are used for cervical cancer prevention? Maybe you can talk about that, the methods that are used for prevention, and then you can delve into each. Yeah.
Okay, thank you, Diana. Now, in cervical cancer, we have 3 modalities of prevention. The first modality is primary prevention. In primary prevention, we are trying to prevent HPV infection from the beginning. That means to prevent HPV infection, more or less, it's about information. We give people information on maybe sexual abstinence, healthy lifestyles, and for those who cannot abstain, we advise them on using condoms. And we have a major primary HPV infection prevention, which is HPV vaccination. In HPV vaccination, most of you have heard about it. In Kenya, we are vaccinating our girls from 9 years to 15 years. And that is being given free in the country for the girls only. However, the women can also get it at a cost, and it's administered up to the age of 45. It's usually given in 2 doses, the first dose and then 6 months later. Research has come up showing some people have benefited with just 1 dose. So this HPV vaccine prevents even other cancers apart from cervical cancer. It can prevent cervical, it can prevent oral, anal, and vulval cancers. So it's a benefit. The second modality is secondary prevention. In secondary prevention, we now aim at detecting the lesions. Like we said, HPV causes changes in the cells, and these cells end up as lesions on the cervix. So secondary prevention is mainly about screening. Screening has many modalities as well. There are 3 main types of screening. The first one is now the HPV testing, where we test for the high risk HPV viruses. And in the HPV detection, once a positive test is shown, it doesn't mean one has cervical cancer. It just means you have the high risk human papilloma virus, and it's much more sensitive and more effective as compared to the others. Another test is a pap smear. Now, the pap smear is it's also called Papa Nicola test or a pap test. It involves getting some cells from the cervix and taking the cells to the lab so that they can be viewed microscopically. So this is also a test that is done to women, but the HPV is only done for women 30 years and above. Pap smear can be done to any woman above, in Kenya, the recommended age is 24 years to 49. But any woman under 30 can also get a pap smear done. Pap smear, I'm sure most of you have heard about it. It's either taken as a slide or it's a fluid taken to the lab. If abnormal cells are seen on microscopic examination, then further tests are recommended. The third modality of screening, we call it visual inspection using acetic acid. Now, this is a test where it's a method where early cells changes are detected using, it's actually visual, and acetic acid is applied on the cervix, and the changes are viewed with the naked eye. Now, the changes are what makes the healthcare provider know whether there are any abnormal tissues on the cervix. The changes can be either due to the reaction of the acetic acid or any other cause. So if it's a positive test, then further investigations are also required. Now, that is the second modality of preventing cervical cancer. The third one is now tertiary prevention. In tertiary prevention, we want to detect and treat the lesions, or even though if it's not a lesion, it has gone to cancer, we want to detect and treat early and promptly. So that if it's a lesion, we said the lesions come, the lesion can be removed and it won't progress to cancer. If it's cancer itself, then we need to identify, detect it early, and treat it. Remember, cancer, like Dr. Diana said, is preventable. Cervical cancer is preventable. So the only take-home point here is it is preventable and it is curable if diagnosed early. Diana?
Thank you so much, Julie. A question that everybody always has at the back of their mind: how effective are the HPV vaccination and the regular screening? How effective are they in preventing cervical cancer? Because I believe that is a question most women have. That is why we have very low uptake for screening and even low uptake for the HPV vaccination.
Now, thank you, Diana. HPV vaccine, like any other vaccine, is highly effective at preventing HPV-related cancers. The reason why we are giving younger girls is because we are giving them before they get exposed to. We assume at 9, at 10 years, at 11 years, they have not been exposed to the virus. So the beauty of a vaccine is using it, getting it before you are exposed to the virus. And that is why we say it is highly effective, especially when you are younger, before you start sex, before you, our girls, we assume they have not started at that time. And if they have, they are not, they're not exposed to the high risk ones. So that is why we say it is highly effective if given at the right time. For women above that age, it's still effective, but it's not as effective as pre-exposure. Screening is also very effective because the purpose of screening, remember, is to find that lesion that is not causing, like for example, if you have a lesion, it is not painful. You can't even feel it. So the purpose of screening is to identify the problem before it gets too big, or even before anybody else, before you realize it is there. It is trying to identify, and that is the purpose of screening. So they are very effective. Whichever method you use, it is very effective, and it can save you from getting cervical cancer. The purpose of screening is to prevent the cervical cancer. Diana?
Thank you so much, Julie. And so we are telling all the ladies here that cervical cancer is preventable when it is detected early. So what the message we are passing is that it is important that you can always go for your screening as often as you should. Maybe, Julie, you can tell us the threshold. How often should I be screened at the age of before 30 years, after 30 years, after 40 years? Maybe you can tell us how often should a woman be screened?
Thank you again. Screening is done to anybody who has been sexually active. And in Kenya, our age group is the reproductive health group of women, that is 25 to 49. That doesn't mean above 49 you're not screened, you're just screened less. So depending on the test that you have done, for example, if you have a HPV test and it is negative, you can go up to 5 years before the next test. However, there's a group of immunocompromised women, HIV positive women, who have to be screened more regularly because they have a higher risk of getting the cervical cancer because of their immunocompromising state. If you do a pap smear, if the test is negative, you're required to repeat it after 2 years if you have HIV. Sorry, yearly if you have HIV, and if not, you can do 2 yearly. Usually we say, because people have a tendency of not getting screened regularly, we tell people if your first screen was okay, then you can skip a year. But if it had a problem, you need to do it yearly until we are comfortable that there's no lesion anymore. For the VIA, it's the same. For the visual inspection, it's the same as a pap smear. If it is positive, you need to do it more regularly. And for HIV positive women, it is even more regularly done. Now, if you're above 50, then, and you have been screened before, because we are, like where I work, we are getting women who have never heard of a pap smear, they've never heard of a cervical cancer screening, and they're coming with stage 4 cervical cancer. So the first contact with that woman, even though it's after 50, we need to screen, and screen maybe after 2 years. But once somebody has been screened severally and they're 50 and above, then we can spread it to 5 yearly, depending, actually it's individualized, depending on the kind of history the woman has. Diana?
All right, thank you so much, Julie. I'd like to invite Jennifer. So Jennifer, you're here. I'd like Jennifer, you share with us your experience. Probably share with us your experience now that you have learned what cervical cancer is, what we need to do, the screening that comes with it. I would like you to shed some light, take us through your journey, share your experience from diagnosis to treatment and even beyond. Over to you, Jennifer.
Okay, thank you, Dr. I'm coming through my son's laptop, so don't worry. As I've said, I'm Jennifer. Jennifer is a cancer survivor twice. I say twice because I was diagnosed in 2014. I was treated from 2014 October, not October, June, all the way to October. I remember my last treatment was 21st October, which was a brachytherapy. And I shall tell people the most painful thing I've ever had in this world. After October 21st, 2014, I was told that I go and wait and I'll be given information about how the treatment will proceed. Because I had done radiotherapy, I had done chemotherapy, and brachytherapy was the last one. I had 3 doses, and I was told to go and wait. Then that time I waited. I was called after 3 months. I went for a test. I was told there are still residues of the disease. Then I continued doing tests. Then after around 6 months, the doctor told me that they no longer see the disease, and I was very happy. Then I continued going after every 3 months for an MRI, like that. That time I started to be corrected. There was no PET scan in Kenya. If it was there, I don't know, but I believe it was not there. So I continued like that. Then the doctor told me you'll be coming after 6 months. I continued like that. Then on the 3rd year, 2017, I just went as I delayed because I believed I was okay. I was healed. I delayed, and I was given a call by the nurse then, who was in the area where we were doing a MRI, and she told me, I can see your appointment imepita. She used that word. When are you coming? I told her, since I'm a teacher, I'm waiting for the midterm break so that I can come. And during the midterm break, I showed up for an MRI. A very bouncy, happy, healed person, only to be told that, boom, the cancer is back, but this time it is in the uterus. So we begin again. The first treatment, I didn't have any surgery. So the doctor told me, I treated you in the first, I've tried it the first time, I did not succeed. So this time I'm giving you to a different doctor, a lady doctor. The first one was a male, the second one was a lady. So he told me, I'll give you to a gynae oncologist who is going to go through with you, and I believe she will help you. So the same day I went to the new doctor, she sent me for all the details, MRIs, the past MRIs and the rest. And she asked me, why is it that they never removed the uterus in the first instance? And I told her, I don't know. So from there we started confirming again if it is really cancer starting. I went and did another MRI, And then we started again in 2017. And this time it was a crazy, crazy treatment. We continued. And then after I started this treatment in 2017, July 1st. I did an extensive surgery, radical hysterectomy. I think the doctors know what I'm talking about, a crazy thing also. And then after like a month, I started chemotherapy again. Remember, I had done chemotherapy 3 years ago. I started chemotherapy again. I went through the treatment again for several cycles. I finished, and this time the doctor told me, "You not go again through radiotherapy. Let us observe, let us watch." And we continued watching. At that time, I think in 2018, there was a PET scan was there. I did a PET scan, and she told me the progress was good. I continued going for tests, checkups, and after 3 years doing a PET scan each and every year, she told me she's sure I'm free of cancer, but I'm still observing. So my diagnosis was funny. That's why I never started with it. My diagnosis in 2014 was interesting. Being a teacher, I wanted to exit teaching because, as you know, teachers, you have to do so much so that you can get some pay increase. And I was feeling like I need to make more money. And a friend told me, because you get money every month, make sure you get good amount of money, keep it somewhere so that if you miss your salary, you not get stressed. Number 2, buy a nice car. So when your business fails, you enter in your car and cry inside there. Lastly, but not the least, go and check for lifestyle diseases. So I started with the mammogram. I was clean. Diabetes, I was clean. And then where I teach, there is a doctor's plaza across. I crossed and I went and I told the doctor I want to do a pap smear. I was 38. And she was like, "Why do you want to do one? You're still young." And I insisted, and I did one. And boom, that's how my diagnosis came. I was a very fast woman, moving very fast, wanting so much. I was already a mother of 3 at that time. And my diagnosis brought everything down. So it is my experience from diagnosis to treatment. The beyond now is after the treatment. After the treatment, my body was really beaten. A lot was done on my body. My uterus was taken, my cervix was taken, my ovaries were taken. So what that means to a woman, and especially a woman of today, menopause, immediately, sweating, immediately. Radiotherapy, a lot of it, scarring of the thigh muscles, of the muscles around the hips, so you cannot move much. So you keep on exercising all the time, doing a lot of yoga, Pilates, so that you stay fit or you stay active. Then because of a lot of cycles of chemotherapy, I got what we call the peripheral neuropathy. That one is not easy to notice, but for those who have come up near me, like Dr. Diana, I don't know whether she has noticed. I always keep on moving my fingers. I always wear sports shoes all the time, whether I'm wearing a dress, whether I'm wearing a trouser, because of the peripheral neuropathy, because of a lot of chemotherapy. Now, the beyond, the good thing is that after 7 months of intense treatment, I was able to go back to class and teach. I never moved up from ATSC because I told the doctor I want to exit, and she told me, no, you cannot exit because it's always a power of knowing that you're waking up tomorrow to go and do something. And I followed what she advised. So I'm still teaching. Yeah, and I'm happy to be a teacher. Thank you. Dr. Diana?
Thank you so much, Jennifer. Let us give some emojis to appreciate how vulnerable Jennifer has been with us. Thank you so much, Jennifer. And I believe, despite all that information we've been given before of the science, of the, the basic information and how we prevent, stories that come from a survivor, somebody who has gone through this, really sent the message home. Maybe, Jennifer, I can ask something before we can take each and everyone's parting shot. What message would you like to share with women about the importance of screening and prevention?
Is it the last opportunity for me to talk?
Not yet.
Okay, the message I can tell ladies. The first thing is listen to your body. When you listen to your body, sometimes, you know, cancer, the word cancer shakes people. And people start behaving like they don't want to hear it. Because most of the time, I'm a cancer survivor. Unaona kama alikuwa anaangalia kando, that person always stands and looks at me and pays attention to listen. So the message I give to people, ladies, men, wherever I usually go, because I talk a lot, is medical checkups are very vital. Screening, early screening is very crucial. We are not just screening for the cancer. The doctor who talked before said that we are looking for the virus. If that virus is caught early, you will never get cervical cancer forever, because it can be treated and it will be okay. Then again, another message I would wish to pass to the doctors and anybody who would wish to listen. The time I was getting treated, I was using NHIF. And it was very cheap to be treated through NHIF. Because you only needed to give your pre-auth to the hospital or to the doctor, and then you will get an SMS saying you can go for the treatment days before your chemo, or days before your brachy, or days before your surgery. So if there is anyone who can maybe hear this, the cancer survivors are suffering. So we are telling people go for the screening. Like if I can give you an example, in October, I went to Kitui with my foundation with several doctors. We did breast screening. We need the cervical cancer screening. We got 8 breast cancer suspects. We call them that. Only 2 now have started treatment. Why? In Kitui, there is no mammogram. Niko to nyumbani. The whole of Kitui count, there is no mammogram machine. It's not politics, just people health. Then the other thing is, if there is anyone who can listen, the amount the cancer people are getting is not enough for the treatment. So no matter how much you tell people, go screen, because me, I've seen this one live. Somebody asked me, sasa nikipima nikipatikana, nitafanya nini? Where do I get the money to put it? So if there's, I believe that since 2019, I've been doing cancer awareness. And I remember the first launch, Dr. Diana was there. She's the first person who talked about it. From there, every year, we do cancer screening and awareness at least 3 times in a year. There is no single day we've ever been funded by anybody else apart from my friends who wants to care. Just some few people for the screen. But when it comes to treatment, that is where the problem is. So the message is, let us go for screening. After that, after screening, let us go for the treatment. Now, if we want to go to those people down there, because maybe everybody in this meeting today has a medical cover. I usually go to those who do not have, they only have SHA. So then, if we tell them to screen, how will they be treated? We need to have that. I know maybe being doctors and the rest, maybe we cannot go beyond that. But for those who are doing research and the rest, I know you can influence this. Screening, treatment should go together. That is my take. That's it.
Thank you so much, Jennifer. Probably just one more question I would want to ask you before we can switch to the question and answer. I would want to ask about after diagnosis, what challenges did you face emotionally, physically, with your family during the journey? How was it support? How was it?
From the family at first, in the first diagnosis, it was not easy to disclose because I was fearing stigma. So I only told my husband, my place of work. I never even told my mother and my sisters because I didn't want anybody to change the idea that I'm going to leave. I really wanted to leave. And in 2014, the people I knew had already suffered from cancer. I didn't know anyone who survived. So I never wanted to tell many people so that I don't lose focus of, fulani ali, like that. So the challenges I faced was dealing with the disease alone. Because I had to leave my kids in Mombasa, went to Nairobi for treatment. I used to come like after every 2 weeks, but the doctor was really against that because Mombasa has a very bad malaria. Emotionally, it was not easy. In the second time, it was very challenging, crazy, because now the treatment was chaotic. The surgery, so unalazwa hospitali, so that means people will know there's something wrong. So now very many people were aware. And again, you could see people, somebody comes to see you and they look like, oh. And you could read people's faces and the rest. And it was not easy. But from the immediate family, I was supported. My sister, that is in the second time in 2017. The second time, my sisters, their husbands, because I stayed in Nairobi for so long because of the surgery. Then another challenge, which was physical now, I've already shared, the retinopathy, that is the nerves affected, that is the extremities, the nerves, then the scarring, then the one which has really continued to bother me is the stigma. The stigma that still after all those years and after people, I'm a very, I don't know, Dr. Diana knows me. I'm a very active person in the gym, anywhere I dance, I do everything. But still somebody doesn't see that you're doing well. You'll hear, like I remember there's a day I went to a church meeting somewhere and one of my, a closest church mates went and told somebody, niweke chakula ya ule anakuanga mgonjwa, still people believe you are still sick. And the way you are seeing yourself so perfect. So that is something, the stigma is something we will not shake it off so fast, but it's a challenge I've not yet understood. I've not yet understood. Emotionally, I still feel like cancer took something away from me. As I've said, I'm not that fast anymore. I have to narrow down everything I do because still I've gone through so much. A lot has happened to my body. I'm aging also. So emotionally, I have to talk to doctors here and there. And then maybe for my mental health, I also talk to people who are specialized in that. So emotionally, you things will never be the way they were before. But yes, there are challenges. So what do? We have to come up with ways of overcoming them. Yeah, that's it.
Thank you so much, Jennifer. We really appreciate the responses and how you have shared your journey. We had two questions that were asked in the public chat, and one of them is what is black therapy? So what is that is brachytherapy, a cancer treatment which is done through radiation. And someone also asked, does having fibroids in any way predispose you to cervical cancer? And Julie has answered, fibroids do not predispose you to cervical cancer because fibroids are not malignant. So I would like to request Jennifer to just give us a very short brief on what are the methods of treatment, because we have heard about the hysterectomy, the brachytherapy. You can just mention very briefly, and then as you finish mentioning those, you can give us your parting shot, and then we can have also the other guests giving their parting shots. Then we can hand over the meeting to the president. Over to you, Julie.
Thank you, Diana. And thank you, Jennifer, for your story. Now, once you're diagnosed with cancer, there are various treatment modalities that you can be given. Now, treatment is also dependent on the stage of the disease that you have been diagnosed at. Usually, there are four modalities. One is removal of the cervix. That is a big chunk of your cervix is removed surgically. Another one is complete removal of the uterus. That is hysterectomy, like Jennifer mentioned, that is TAH. And the third one, they give you chemotherapy, and then there's radiotherapy. Now, just to go a little into detail, when you're having surgery, the doctors can either decide to remove all the uterus plus the cervix plus the ovaries. However, most of the times you'll find women are diagnosed with cervical cancer and they have not finished having the number of children that they require. So sometimes they do it fertility preserving surgery, which involves removal of the cervix alone with some preservation of the uterus and the ovaries. Radical hysterectomy, like Jennifer had, they removed the uterus, the cervix, the ovaries. I think the ovaries were left because she was a bit younger. Ovaries is where we get our hormones from. So radical hysterectomy is actually trying to remove as much as possible that could be affected by the cancer cells. Now, in later stages, sometimes treatment is simultaneously administration of chemotherapy. Chemotherapy is intravenous drugs. And the advantage of that is it goes to the rest of the body, just doesn't concentrate on one place. Radiotherapy, however, is targeted therapy where, it's exposure of radiation to the particular part where the cancer is. Now, there are two types of radiotherapy, like Jennifer has mentioned. There is external beam radiation where radiotherapy is given. For example, if you're targeting the cervix, it's given through the abdomen to the cervix. And then there's also the internal one that I believe what Jennifer was talking about, brachytherapy. Now, in brachytherapy, they insert some rods which have radiation into the vagina so that they can target the cervix. So that is brachytherapy. Sometimes there's something we call palliative care, palliation treatment. This is treatment for somebody who has extensive disease and they cannot benefit much from, the conventional treatment. So the purpose of that palliation is to make them more comfortable if they're in pain. Maybe they give chemo and minimal radiation, just to make them comfortable, pain-free, and, just to make them better than they are, although it is not complete treatment. Now, my parting shot is, I hope I'm clear. Diana, did I leave out something? Anyway, my parting shot is, the primary goal of prevention is not prevention. The primary goal of screening is not prevention. Is prevention, not detection. We're not just detecting the HPV, because once you have a HPV done and it's positive, you're still supposed to go for a further test. It could be a pap smear, so that we look at the cervix. And then again, HPV is the main cause. So HPV test is one of the best tests. Vaccination is also one of the most effective prevention strategies, and treatment is highly effective when found early and treated promptly. So let's get screened. Tell your mother, tell your sister, tell your daughter about this information. Share this information so that we prevent cervical cancer in totality. Thank you, Diane.
Thank you so much, Julie. We appreciate those responses. Before I invite Joan, I want to find out, Julie, there is a question on the insurance. Are you able to mention something about insurance? Maybe you can see the question and we can allow you to probably go through it as Joan gives her parting shot. Joan?
Thank you, Diana, and thank you, Jennifer, for sharing your experience. I think Jennifer has emphasized a lot on screening and treatment, timely treatment to prevent cervical cancer. I would also emphasize more on HPV vaccination. So there's been a number of myths going around on the safety of the vaccine, or whether it affects someone's reproductivity. So the vaccine is safe and it's gone through rigorous clinical trials and also safety monitoring of its safety post its development. So encourage your neighbors, your families, or anyone else to take their girls for vaccination, because that's the only way, like 25 or 10 years down the line, we'll see the change in the numbers of cervical cancer in Kenya. So I believe the vaccine was introduced in 2019. So the first cohorts, the first girls who are given are still maybe getting into their 20s. So it's very useful for them in the years to come. And I would like to emphasize the role of men and in getting the girls vaccinated, and also the men also play a role in the spread of HPV. So as much as HPV causes cervical cancer, we also have other cancers that men are predisposed to from HPV infection. So the head and neck cancers, we also have anal or penile cancers. So HPV also affects or increases the risk of men getting those types of cancers. So so the men also play a role in protecting the women from cervical cancer, and the other way around. So thank you, Diana, and thank you for having me in this session.
All right, thank you so much, Joan. I think we have another question. Somebody is asking, kindly confirm that cervical cancer is only gotten through sex and mostly it's the man that infects the woman with HPV. So I can answer this one. So first of all, cervical cancer is not caused by sex itself, but almost all cases are linked to the infection. And we are talking about high risk human papilloma. So that is HPV 16, HPV 18, HPV 9, HPV, I think 11. So we have those very common ones. But also we have those HPVs that do not cause this cancer. So, and these high risk HPVs are normally transmitted through sexual intercourse. But what we are saying is that primarily sex is the main way of spreading the HPV. But also we have vaginal, we have anal and oral sex. But then again, we're also saying that this transmission can also happen skin to skin with any contact in the genital area. So it is important that we're able to understand that many HPV infections can cause cancer. But people normally, a healthy person will be able to clear these infections in their body normally. All right. And for you to be able to move to cervical cancer after having these HPV infections, your body has tried to fight, these infections, but your body has not been able to fight them. So there has to be what we call persistent infection with the HPV. And then we have other factors. The age of the woman, we have things like comorbidities. What other diseases do they have? How long has she been exposed? So there are many factors that normally will lead you to the next step. That is why we are saying it is important that over time we can keep on having regular cervical cancer screening, like pap smear test and even HPV testing. And of course, we have seen how effective these methods are. I'm attending the Africa HPV Forum today and tomorrow. I've been there, and tomorrow we also have a time. So we are saying we need to change this cervical cancer screening from cervical cancer screening to cervical health, screening, because we want to see the health. Because when we target with cervical cancer, already it takes people to go back. So it is important that we can also be able to package these messages in a way that women are able to get attracted and go and find out the health of their cervix. So another question that is also related to this is that, does it mean that women who are sexually inactive, irrespective of their ages, are likely less disposed to cancer? So I want to talk about the brief anatomy of the cervix. So what happens is that over the age, when a woman gets to puberty, the cells of the cervix keep on changing, and we have an area we call the transformational zone. So this area keeps on changing, and the cells of the cervix keep on changing, whether you're having sex or not. And we do not know. And we know things like HIV, all this predispose somebody to cervical cancer. So what we are saying is, whether you are sexually active or not, so long as you're a woman, every woman needs to go for screening of the health of her cervix. And then for the young girls, they need to go for the vaccination. And we have so many success stories from Rwanda, from Uganda. I'm going to share with you the statistics of last year, and you're able to see countries that have been able to introduce HPV vaccination and the success rates of how their countries are doing. Yeah, so I think that is what I can respond to those two questions. We have another question. Where can one get the HPV vaccines? Are there specific hospitals or any can administer? So first of all, it has recently been added to our national immunization program. So the government is offering the vaccine, but you can also get it from private practice. So what we normally say is that we are giving it to girls the age of 9 to 14. But if we have girls who are up to 20 years who have not had sex, they're also eligible. So they can also go and have the vaccine. So if you have already had sex, already you're exposed. So you can actually go for a screening. That would help. And the WHO recommends the HPV DNA testing as the core, the main screening method. So in our country, and probably I can say the sub-Saharan Africa, as the low-income countries, it's very expensive for us. So what we are doing is a visual inspection with acetic acid, and this can be done in any health facility. Right now, with the county government, with the development, you are able to get a screening from wherever health facility you are at. We also use the cytology, the pap smears that we have also been doing. So this you can get them from the private facilities, and you can also take advantage of the awareness month, like the October that just passed. We have very many NGOs and hospitals doing CSR and just offering these services for free. So you can be able to align yourself with those, and then at least have that screening every often, depending on the age you are at. Then I hope I have been able to answer those questions, and I see the questions on the insurance are being answered. Somebody is saying, adding on the question about men transmitting the virus, does it mean that they can carry the HPV by being carriers of the HPV? And this can be for how long? Can the men undergo a test to tell if they have the HPV? Let me throw this question to Julie or Joan, if you can answer it, or anyone in the plenary who can answer it. We have a few doctors with us. Help us to answer that question. Then kindly address insurance intervention other than SHA, especially group or family health insurance. So we are going to note this, and we are going to include someone who can talk about this insurance in our next webinar, because I don't know, do we have anybody in the plenary who is able to answer about insurance and how women can get that cover? If you have somebody, please, you can respond in the public chat. But meanwhile, I would like to make an announcement. As one of the areas of focus, we the Rotary Club of Nairobi Thika Road, as we try to make an impact in our community. We are going to be doing these webinars. We have another webinar that is going to be coming. We'll also have a face-to-face meeting next week on Tuesday during our usual fellowship meeting at the Look Hotel at 7 p.m. And we are going to bring in on board panelists who are going to shed more light and talk more about this same conversation that we have had, because we want to make sure that all of us understand the importance of cervical cancer prevention. And then we are going to have another webinar, and at the end of it all, we are going to mark this whole campaign with our HPV DNA testing. So we have already gotten some partners. We are collaborating, and we are going to have a subsidized price for HPV DNA testing. We have said that is a gold standard, and we are bringing it to you. So we are praying that you can be able to mobilize your family members. You can mobilize all the women in your lives. Call everybody. Now that you have had this information, don't be mean with yourself. Please share it. Tell anybody who can listen, who can be able to at least get something, so that we can be able to fight this burden that is cervical cancer, because we know it is preventable. If you have girls, let them be vaccinated, because we have seen that HPV vaccination is actually effective and it is very safe for girls. So I believe, Jennifer, you already gave your parting shots. All right.
Okay. Can I go on?
Yes, please, Jennifer.
Okay. My parting shot is that as human beings and as ladies, mostly, I like addressing ladies. We should take ourselves as that other person. In the family, it is the kids first, the husband first, and as we come later. So my advice is that, or my parting shot is that, let us take us ourselves as our number ones, our own, let us put us where no one else has ever put us. That is priority. Take time to listen to your body. Take time to look at yourself, what you've been doing, so that if something happens, you'll be able to know it early enough. Some experiences, like the people talk to, most of them, the ones who usually get diagnosed, they usually tell you, nilikuwa nasikia, you know, I was feeling something, but sikuambia anybody, you know. If there's something you feel in your body, even if you are not going to hospital, share it with somebody. Somebody will encourage you either to go for a checkup. Don't just keep quiet. For me, what I've realized so far is that since I was diagnosed with cancer, hii maisha haiendi popote. So it's good to take care of ourselves and put ourselves first. Then also take time to help others. Helping others also gives us that energy to continue pushing on. If somebody calls you, give advice, give direction. Sometimes maybe you will not be able to help financially, but giving ideas will help a lot. That's why we started Jeniffer Cancer Foundation. And what do? I'm a teacher. The doctor who treated me last year told me, go, because you're a teacher, go and use your voice and tell people your story. Direct people. And that is all what I do. I don't use a lot of money, but my voice is always out there. So can you use your voice and tell somebody something? Don't ask me what you're going to tell somebody. Nendo wambie hii ya leo, this one for today. You had something like cervical cancer screening, early detection, saves lives and saves wealth. Thank you very much, Dr.
Thank you so much, Jennifer. We really appreciate your candid presentation. Thank you, Joan. And thank you, Julie, for being present and accepting and heeding to our call. I would want to hand this meeting over to our president. Thank you so much also for attending and listening in. I'm trusting that you have learned something and you have picked something from this conversation. So I'm hoping that the next webinar we are going to have 100 people, because today we have had 50. So each one of us is going to spread the word and invite someone else. So if you want to reach out to any of us, please, our contacts are on the poster. You can be able to see the number of our president and our club admin. So maybe Prezo and club admin, you can add your numbers on the chat box so that anybody who would want to reach out to you can be able to reach out to you and get to any information that they need from us. So over to you, Prezo, and thank you so much.
Wow, that was really a very, very insightful session. I have learned so much key takeaways from our panelists. I know we shall be giving a vote of thanks much later on, but thank you very much. At some point, we were actually 70, 75 thereabout, and that tells you there is need to amplify the whole discussion around cervical cancer and just cancer in general. So to Joan, Siman, to Julie Muthoni, to Jeniffer, Munai, thank you very much for honoring our invitation. Thank you very much for joining the Rotary Club of Nairobi Thika Road to share and shed more light around this discussion. I do hope we shall equally find time to join our club. We meet every Tuesday at the Look Hotel from 7 p.m. Allow me to request Rotarian Irene Miyako to kindly move the vote of thanks.
Good evening, everyone. And
Good evening.
riding on the protocols established, my role is to drive a vote of thanks. And I really want to say before I do that, I'm very, very well inspired and well informed. And I'm also happy that we've been able to, I think we've planned this thing, and for it to really start off on a big and a high note, we are really, really very happy. So first, I would really want to thank God for enabling us to get to this place we planned, and for it to be this successful. I really want to thank him in a very, very special way. I also want to thank our President Ruth, for your leadership. As we were discussing and planning for all this, you're always there with us, giving us the wisdom, the guidance, and above all, with the club admin, allowing us to have it as part of our club activities. We really don't take that for granted. We really want to thank you for that. In a very special, I also want to thank our chair for the committee, who is Dr. Wangeshi, for the leadership that she has given to us and ensuring that there is this success. Thank you very much, Dr. We appreciate it. And it's because of your leadership and your commitment to this cause that you've been able to bring to us great speakers. Trust me, I was listening, I'm like, wow, I just wish we had a whole day. So I really want to thank our speakers that they've really shared their insights, they've shared their lives. I want to appreciate Jeniffer for sharing your personal life. At times, it takes a lot of courage to be able to go deep into your personal space and to share with other people. We really want to appreciate you for that. Julie, thank you so much. I can see you're still even responding even now to the questions that people are putting in the chat box. We really appreciate that and believe that this is a journey that we've started, that we are going to work on together in this great journey of especially spreading the word of prevention. To Joan, asante sana, and also challenging us in the space of research, that a lot needs to be done. And I love what Dr. Wangeshi has shared in terms of the conference that she's attending. There's so much is happening in that space. And I do believe that when we have the right information, then we're able to really save lives and also save our lives. And I loved the bit that we really need to take care of our cervical health, you know. I think it's an area that is neglected. So I really want to thank our panelists. You've done an awesome job. You have really impacted on us. And if everybody is feeling like they are feeling, we can't wait for the screening. And just to be able to know that these facilities are available, because like most of us, like one of the panelists said, is that when you interact with most people who've gone through this, they'll be like, you know, I used to feel like this, I used to feel like this, but we don't have that confidence or that courage to go for the testing. So for me, as a challenge that we need to spread our voice, I think the voice that we should be spreading is that people, we embrace that people go for this testing, because prevention is better than cure. And even when after the testing, whatever comes up, then you're able to walk through the journey. So really, I wanted to thank you and appreciate that. And also in a special, I want to appreciate the committee that planned this great session. I know you've been meeting almost weekly. You've done an awesome job, and I'm sure when you see the results of what you have been discussing as a club, we feel that you guys are really taking care of our health. And we are going to ensure that we keep on listening to our bodies so that we don't let all this effort down. Finally, and not the least, I want to appreciate all the participants who've attended this webinar. At a point, we were around 72. So that was a great number. And the appeal that I have is that because this is the beginning of women to come, if each one of us can spread to at least 2 people, we can be assured that we're going to have over 300. So let's spread the word and let's continue listening to our bodies, going for the screening, and let us use our voice. So thank you so much, everyone. And I wish you all a great evening. And in case there's anyone who I may have left out, I almost forgot our technical team, ensuring that the webinar is running well, the coordination between the panelists and all of us. I don't think at any time we drop down. Our PR team, thank you so much, even for the wonderful flyer that went out. The communication, the packaging was really, really rich. We really appreciate all of you. In case I may not have mentioned, you just know you're so special, and we appreciate each one and everyone. Thank you so much, everyone, and over to you, our dear President.
Awesome. Thank you very much, Rotarian Irene Miyako. I acknowledge even the men who have come in on this call just to ensure that they equally learn something from it. Thank you very much. I kindly request, if you're in a position to kindly put on your video, please put it on. Then, Dr. Wangeshi, are you able to take a screenshot of the video of the participants on this call, kindly? So please, if you're able to, please put on your video so that you can take one screenshot just to indicate that we were available. I know some of us are in places where we may not be able to put on our videos, but kindly, if you can, just put on your video.
All right, as we wait for people to put on their videos, let me switch on my laptop. I think it will have a bigger screen that I can take the screenshots. So just give me
Okay.
1 minute. Meanwhile, we can give our emojis. Thank you so much for attending.
For the video.
For the videos, oh, they put on their videos.
Yes, so that you take one nice screenshot. All right,
right,
Dr.
just
Diana,
a
are you good to
second.
go?
1 minute. I don't know what happened to my laptop today.
Okay.
I don't know. Is Timo able to?
No, he's
Or
not on
anyone
the
else on a
call.
computer? Okay, so
Eric?
I will just use my phone.
Okay.
I will just use my phone. So I'll take the first group, then the second group. All right, 1, 2, 3, go.
There.
All right,
Smile.
page. Oh no, it can't take everyone. So just a few of you. Oh, here we are. My laptop is here. All right. Okay. Let me just make the tiles smaller.
Hey, we have smiled.
Yeah, continue smiling. Continue smiling as I make the
Presume pause.
Yes.
Poleni. I need to see the awesome. It's
All right.
coming. Just be patient. Technology can let us down when we need it.
No
So
problem. Take your time.
please,
Take
thank
your
you so
time.
much. So I think Google Meet is different from Tiled. Okay. Wow, now I have everyone. Okay. So I wanted to make it tiled so that you can see everyone.
Tell us when to smile.
Yeah, so that we
All
don't
right.
really put our teeth out so much.
All right. So 1, 2, 3. Smile. Your cameras are on. I'm so
Yes.
sorry. Look at what my laptop is doing. So this is how my laptop is seeing all of you. So I'll just take this because I don't know. So let me just take this, then we call it a day. At least your names are here. We have some
Yeah.
evidence.
Okay.
Thank you, Dr.
All right, thank you so much to all the participants who've joined in. Allow me to recognize the clubs that have joined us. This evening, we had the Rotary Club of E-Club Safari, we had the Rotary Club of Athi River, we had the Rotary Club of Embakasi, and we had the Rotary Club of Westlands. Thank you very much for making time to join us. As Dr. has mentioned, next week we shall be having a physical meeting where we'll be having expert panelists. So please look out for the flyers that are going to be shared on our social media platforms. We are across all media platforms, that is Facebook, Instagram, yes, Facebook, Instagram, and Twitter. So our handles, just Rotary Club on Nairobi Thika Road. Please like and follow, and you should be able to get timely updates regarding our fellowships. So if you do have a glass, please charge. If you don't have, please place your left hand across the chest as we give a loyal toast. All right. Thank you. Thank you to all. And I wish you all a lovely evening. And as the panelists have mentioned, early detection saves lives. Thank you and enjoy the rest of your evening. My name is Ruth Munyi. God bless you all.
Be blessed too. Thank you so much. Have a good evening.
Good
Bye-bye.
night. Be blessed. Have a blessed evening. Thank you.
Thank you so much.
Thank you so much, everybody. Have a lovely night.
Saini saa 6 ya usiku. Saini saa 6 ya usiku.
So unataka kunipiga?
Nataka kukupiga aje? Nakuja hapo na nikasirisha.
Wacha kuharibu hiyo hand wash. Osha tu na hii maji. Na ukamue hapo wanike.
Nikamue nini?
Hiyo kitambaa osha kwa hiyo maji.